Hello, hello, hello. Good evening, everybody, and welcome to the next Town Hall hosted by Hip Hop Public Health. We're excited to have you with us this evening, and we look forward to not only an educational conversation, but a real conversation with some real things that we can all take action on. So to open up, I'd love to just give a quick introduction to our experts this evening. Dr. Olajide Williams, who is the founder of Hip Hop Public Health and also has a day job as a neurologist at the Columbia University Hospital, still teaches and still sees patients. Dr. Angela Rasmussen, who is a world-recognized virologist and world-recognized virologist who has been with us a couple times in our town halls, and we thank you for joining us tonight. And then last but definitely not least, the premier creator of politically and socially conscious rap and esteemed advisory board member to Hip Hop Public Health, Mr. Chuck D. Thank you all for joining us this evening.
Thank you.
Before we get started, I do want to give a quick shout out to Munson at Rolling Out for their partnership once again this evening. And it's very important that I say Munson is in Chicago. So he'll know what I mean by that. All right, y'all, here we go. We're going to jump right in. A year ago, we were under a national mask mandate and limited indoor gatherings, various policies for social distancing in public spaces, reminders, invitations to wash our hands, abstain from touching our own face, and to keep a little bit of distance. A year later, we're still here. So we want to talk about what do we need to know? What should we do in this next, pardon the pun, Chuck D, fight the power of COVID-19? Tonight, it's all on the table, science, rumors, and actions. To start off, we are Hip Hop Public Health, so we must do a healthcare, that's a verb, check-in. How are you all feeling tonight, personally? We'll start with you, Dr. Angela.
Feeling okay. I'm a little situation. I think we're gonna get a night. So, but I'm completely back. I feel 100%.
I think we're getting a little bit of feedback. If you could maybe switch your earbuds to the computer. Can we try that one more time? Yes.
Okay. Health-wise, pretty good. I'm completely vaccinated.
I'm a little filled with anxiety because of the situation, but we can get into that later tonight.
Some of that was garbled, but I know you're going to keep us posted on how you're doing, so we'll make sure to give you another chance to try again. Dr. Williams, how are you doing?
So I'm thankful to be alive. I'm thankful to be here with you and with everybody. I have great concerns and anxiety about what's going on around the country, and I'm tired. As a healthcare professional who's been dealing with this for so long now, I'm tired. But apart from that, I'm just excited that we still have hope and we still have a lot we can do.
Thank you. Mr. Chuck D, how are you feeling?
It's a crazy period. And matter of fact, how do I feel looking at, over the last week, we've seen like 3 different shifts on the news of what we think, where we think we're at and where we are right now and what's to come next week, which is the unknown. COVID cases rising. I'm a father of a 10-year-old daughter. I have concerns with her going back into a situation of going back to school and no one knows what's happening. The variant has taken on a different concern than what we had last year when people were telling, well, the children are safe from this and old folks and the everyday person has to get vaccinated, get 2 shots, in some cases, 1 shot for some. And here we are a year later and the table is turned. So what does this mean? It requires my full attention, and I think every adult out there needs to be at full attention. You're not going to become an overnight practitioner or doctor like Dr. Rasmussen or Dr. G-Day. So you need to really seriously pay attention and not try to play the freestyling doctor, because that's just not going to work. You might be able to freestyle some rhymes. Don't try to freestyle medicine and science.
Absolutely. So the universal vibe is exhausted, but I know that we're all going to remain hopeful, because that is what we must do, and vigilant. I do feel like there's been lots of conversations about COVID-19 and the variants and the mutations and what all this means. Can we just take it back for a second to make sure that we're all starting from the same ground point? I'm going to kick it over to you, Dr. Williams, to bring us from last year to where we are right now.
Sure, Patrice. So COVID-19 actually stands for Coronavirus Disease 2019. It's an illness caused by a virus called SARS-CoV-2 virus. It spreads from person to person, mainly through respiratory droplets. When an infected person sneezes or coughs or even breathes, these droplets can land in the mouths or noses of people nearby, and even inhaled directly into the lungs. And spread of this condition is more likely when people are in close contact with one another, typically within about 6 feet. And so I remember, Patrice, I remember the images from Wuhan, China, back in January 2020. I remember sitting, watching the BBC News and seeing all these images where Wuhan was locking down and officials were trying to contain this mysterious virus. And then, I remember, soon after, the new cases and deaths that were occurring began popping up in Europe, and it was named at that point COVID-19. And then fast forward, we're still watching Wuhan, we're still watching China, and then we have our first case in America. I believe it was in Washington State. And then shortly after that, we got even more concerned when the Grand Princess, remember the Grand Princess cruise ship docked outside San Francisco? They had passengers, tested positive for COVID. So we knew it was on our shores, and we knew it had crept in. It was only a matter of time before we ended up in a global pandemic. And then boom, March came along. We had our first case here in New York, actually one of our sister hospitals in New York, up in Bronxville. Before we knew it, everything just spiraled out of control. We were hit with the first wave of the pandemic here in New York, and I remember literally going home thinking, asking myself, is this an extinction level event? Because we were seeing deaths everywhere in New York City. Ambulance couldn't even drop off their patients in our emergency rooms because we had no room. We created all this surge capacity, but we maxed out our surge capacity. I had a colleague commit suicide because she was so overwhelmed by the death and devastation around her. It was horrible, Patrice. But then, we started seeing the disparities. We started seeing the disproportional effect on communities of color. We'd always known this, but the world started seeing this. The nation started seeing, and the cracks that have always been evident became visible to the entire nation, that we're dealing with two Americas here, and one America is getting completely ravaged, devastated disproportionately by the virus. Thank God we felt when, May, June, July came in, and then we saw some flattening of the curve. And then mental health issues started to surface, and we all got very concerned about these mental health issues that were surfacing. And then the vaccines came along in December, and we were relieved that we had vaccines. But around that same time, we learned of these new mutations. So again, we were concerned, despite the news of the vaccines, with these new mutations. Fast forward till today, we're looking at, about 37 to 40 million cases in America, where we have about 600,000 deaths. and we're still dealing with a very large segment of the population that's not vaccinated. And so that's where we are today, Patrice.
Wow, that is a journey, and you would think that we'd be a little bit further ahead, having gone through all of that. However, we haven't quite moved the needle enough. With that said, the concept of understanding what a virus is and how it mutates, and going on to the thing that everybody's talking about, which is the variants. Dr. Angela, break it down for us. What is a virus, and how do these variants get birthed, if you will?
You got it. Well, unfortunately, variants arise. And by the way, can you hear me? Give me a thumbs up. Okay. So a virus is basically a little miniature microscopic machine that exists and is programmed to essentially make more viruses. That's what a virus really does. A virus doesn't have thoughts. A virus doesn't have desires. A virus doesn't have emotions. A virus is really a tiny machine that just exists in the world to make more viruses. And when it does this, it makes mistakes, because any virus is imperfect and is sort of a self-improving machine. It will make these mistakes as it's making copies of itself. And those mistakes are called mutations. Those mistakes often don't really have any effect at all. Sometimes they have a bad effect on the virus. Those mutations that do have a bad effect are called mutations that are under negative evolutionary selection. So those viruses don't go on to reproduce because they have some sort of disadvantage that mutation gave. But sometimes the virus essentially wins a lottery ticket because the mutation process is random. So when these variants emerge, it's essentially because they've acquired a mutation in some part of the virus's genome, the instructions basically for how to make a new virus, that gives it some sort of advantage. And what we've seen now with these variants is there's really two varieties of this. There are variants that, like Alpha and Delta, are more transmissible. And there are variants that it looks like they're capable of evading some of the immune responses produced by the vaccines or by natural infection. That's actually not how they evolved. They evolved because they are better at binding the virus's receptor, which is essentially how the virus gets into cells to infect them and make more copies of itself. But they've been very concerning, and specifically those variants are beta and gamma. It's really good in some ways that Alpha and Delta have continued to outcompete beta and gamma. Essentially, they bought better lottery tickets that beta and gamma did as far as propagating themselves in the population, because they really do have very much reduced efficacy or effectiveness in the real world. And we've seen that both in Brazil and South Africa, where there were large outbreaks of those particular variants. But at the same time, we're hearing all the time about Delta. We're hearing all the time about breakthrough infections. And this is what I said, what you didn't hear, is that I'm fully vaccinated, so I'm healthy. But I'm also very concerned because of some of the issues that have been raised. Chuck was talking about his anxiety about sending his child back to school. We have a huge unvaccinated population in the form of children under the age of 12. And a lot of people have been really concerned seeing Delta spreading within that population and more kids going to the hospital. And that's not because Delta is worse for kids than any other variant of COVID. It's because it's more transmissible and it spreads more easily among them. And so it really does become a numbers game. Now, what we need to do if we want to stop new variants from emerging that are even worse is we basically have to take away the virus's opportunity to buy lottery tickets in the evolutionary lottery. If the virus keeps replicating, keeps spreading, it will continue to acquire mutations, and every new infection is basically a new opportunity for new variants to emerge. Now, like I said, most of the time, these don't have any effect, or they can actually have a negative effect on the virus. But as we've seen, as Jide was saying, this has become a pandemic. Millions upon millions of people have been infected. So the virus has already had a lot of opportunities to buy these lottery tickets. And that's what we're seeing spreading in the population today. It's really, really important that people know that the thing they can do about this is to get vaccinated as soon as they can, if they're not already, and to apply other measures such as masking to get prevalence down and stop the virus from having these opportunities to continue replicating and continue acquiring advantages that make it worse.
Thank you so much for breaking it down, Dr. Angela. And it leaves me thinking it's the human behavior that's going to make the difference here in what we do in terms of what the science is telling us. Human behavior is extremely difficult to change. We know that. Part of it is what we're taking in and where we're taking that information in. So I'm going to move over to Mr. Chuck D to talk a little bit about this misinformation phenomenon, which unfortunately is one of the biggest blocks, I think, of us being able to get fully vaccinated as a country. Right. So as our resident for the culture advisor, Mr. Chuck D, tell us about what you're seeing on social or what you're hearing within circles about information that is simply incorrect.
In 1987, I wrote a song. Thank you, Patrice. I wrote a song called Don't Believe the Hype. And Don't Believe the Hype wasn't to say don't believe the information that's coming at you, was to be able to clearly disseminate information as best you possibly can. I am an interpreter of what I see out there in the world in the writing of songs, and people do the same thing in culture. But let it be known, it's not a replacement. It's not a replacement for what these doctors are saying. It's not a replacement. What it is, and where I think the role of the artist, the culturalist, the newscaster, even the social media blogs is don't feed into creating more hype. You want to believe the fact. Point to the experts at this. Point to the people that have spent years at this, and don't get caught up in the hype machine. It's my job and it's my purpose. Yes, we want a Kanye West or a Rihanna to be able to not fall into the conspiracy hype machine and point to the fact. But people just don't wing the facts on just like coming up with the facts. You got to point to the people who clearly explain in their language without trying to be hip. We had Dr. Rasmussen and Dr. G, they explained that the best, they came halfway as far as they can come. They don't have to be hip. The hip people need to point to the people that know. And that's where we're at right about now. So there's a lot of confusion out there. There's people that all of a sudden they revise and remix history. Like, oh, yeah, we got to watch out for the Tuskegee experiment and not even come even to a paragraph close to what that was about. It's like, because they did not provide the proper medical care for the Black men when in the cases of the syphilis experiment. It's not that they served them with something that would totally do them wrong. So people have to get into the fact of the matter and not feed into the hype machine. And that's our purposes when we're, especially in these scene situations such as television, radio, recordings, movies, social media, those areas are tunnels of communication. Does not mean that the actual fact is going to, you have to sit down and deal with the fact and take a time out and say, what's logic here? What's logically makes sense here? Turn off everything else and deal succinctly with the people that know what the hell they're talking about. That's our job. That's our purpose. Not to say, listen to me. No, listen to the fact. And I think that one of the interesting things that I had put out on social media says, listen, I'm not going to get into this whole battle of the vax versus unvax a year and a half after this thing that people don't know anything about it. Nobody knows about it. But one thing we do know, and these doctors will tell you, if you're suspect about whatever is going in your body that they say, listen, this is a vaccine that will help you. If you're suspect about that, right? When you're if you get caught with this and you're in the hospital, you don't get suspect when it comes down to the thing that's going to fix you. You're like, well, give me whatever it takes to make me breathe or fix me. You don't question that. So we got to be able to look at these things logically with some common sense. And we know sense is not common, but especially now with the internet, ever since the internet came into play, the WW, the World Wide Web, sense has dismissed itself from being common. So you have to be able to defeat the common nonsense that's spread around. And that's why I wrote the song, Don't Believe the Hype, Believe the Fact. And in order for it to be fact, and I say this in a lasting point, the average person reads what they want to read. The scholar reads what they even don't like to read and what they have to read. So don't get into a thing where you're dissing scholarship when people have done 3 times a year's in work to be able to come up with something concise to possibly save not just you or your whole family's life. Not everybody's in the game to deep six the world. So you have to sit down, watch, listen, read, breathe concisely, and not just thing that you just get around to it when you can get around to it, and then you're going to go back to the public pool with what you think.
Right. I just got to say, what you're asking us then is to be present, right? Like be present and pay attention. And at Hip Hop Public Health, we interpret that as being curious and staying curious. And that means we're also staying flexible. So I want to kick it over to Dr. Williams here. Yes.
Patrice, there's one thing we learned from Hip Hop Public Health is that you don't want to contribute to compromising yourself, especially in this time right about now. You cannot compromise yourself. You know what? Throw your hands in the air with the bottle of Hennessy. It might not work when you have to worry about an immune system the next 3 to 5 years. Yeah. Me personally, in the genre that I'm in, and Dr. Williams is right here, and Dr. Rasmussen is right here with Hip Hop Health, I've lost 14 peers, and not just because of COVID, because of all kinds of compromising issues. 14 peers since December 2020. 14 since December 2020 of people under 60. They're under my age.
Yes.
All from hip hop.
Yes.
14 figures.
Yes.
The DMX over here, the Biz Markie over here, the Prince Markie D there. I mean, we can go on to, you could fill a verse up with the amount of names that we lost. And that is not just cause of COVID, but it's from the compromising of your health in an area. Now we're entering a danger zone where you're going to need as much health as you can get going into what we consider the unknown.
Absolutely. And the easy access to it. Dr. Williams is one of the, as we know, four mentioned researchers on stroke, for example. Hip Hop Public Health has a bevy of resources that we make sure are easy to understand, easy to engage with, and easy to help support change your behavior. It's all on our website at hiphoppublichealth.org. And we're constantly coming up with programming for that very reason, Chuck D. We don't need to have unnecessary losses when all the information and the experts are right at your fingertips. Everybody's having these conversations now, right? Not just about COVID, to your point, about mental health. How are they feeling? Whatever it might be. Let's keep going and let's normalize this. And, not a shameless plug, but I'm going to say it, Hip Hop Public Health, that's what we're here for. We want to be part of every single one of those conversations and make the content that's necessary to help people get educated and change their behavior. What I want to do now is I want to talk about the variants that Dr. Angela was talking about and invite Dr. Jide and Dr. Angela to talk about what they're seeing in their hospitals. So now people may or may not be vaccinated. They're coming in with cases of COVID. Now we're hearing from the White House today and the task force earlier, the COVID task force earlier this morning, that there's discussion about people getting boosters. So these are a lot of new words, and not all of us understand what does it mean to be fully vaccinated now? And then when might you be invited to get a booster if that is the case? So I'm going to I'm going to invite you all to talk about what your experience as the experts at the hospitals, how are you all handling boosters, and then share with us what we might be able to expect as a general public.
Well, I can start by saying, first of all, I don't work in a hospital because I'm not a physician, I'm a scientist. So I just want to make that clear because I can't provide medical advice. But I was present at a briefing from the White House, and I've been obviously talking to a lot of my colleagues about it since I work at a vaccine research institute, and this is obviously of great concern. And what we're really seeing now, what the data is telling us, is that vaccines, the mRNA vaccines anyways, there's a little less clarity about Johnson & Johnson, and I'm happy to discuss that, having gotten Johnson & Johnson myself. But regarding Pfizer and Moderna, there are more breakthrough infections with Delta. In other words, more people are testing positive after they've been vaccinated. And that's for a couple different reasons. One reason is that Delta does appear to have a little bit of immune evasiveness, not as much as Beta and Gamma. The vaccines still work pretty well against Delta, but the virus can overcome the immune system, the immune defenses raised by the vaccines, and cause what's called a breakthrough infection. That's essentially somebody testing positive that may or may not have symptoms of COVID. Now, the good news with this is that in general, 3 studies came out today that showed that pretty much in all age groups, a little bit less with older people or people in long-term care facilities who are the highest risk. But for the most part, the vaccines are still working really well as when they were developed against severe disease, hospitalization, and death. So even though the vaccines might not prevent you from getting infected or testing positive with Delta, they will keep you out of the hospital. They'll keep you out of the morgue. And that, I think, is a point that's worth driving home because...
Let me reinforce that really quickly, Angie. Let me just reinforce that. Like today, we probably have about 180 or so patients with COVID in our hospital, right where I'm sitting now, about 180 people with COVID. 99% of them are unvaccinated, and 1% of them are breakthrough infections. I just want to reinforce that point that you just made.
It's a really important point. And what I was about to say was I was about to start being really frank and unfiltered. And I'm not really hip, which Chuck was correct about that. But I can be very forthright.
You don't have to be. You don't have to be.
I don't mince words. And I will say that it's really unfortunate that we've had pharmaceutical companies, vaccine manufacturers talking about boosters on investor calls for the last 6 months or so, really doing some wishful thinking, I think, implying that we're going to be needing boosters all the time. We're going to be getting boosters every 6 months. And I think a lot of people are hearing this news about these breakthrough infections and the announcement that people are going to be eligible for boosters. And they're thinking, is this ever going to end? Are we constantly going to be in this pandemic needing boosters all the time because of these scary breakthrough infections? Now, I think, we should follow the recommendations of public health authorities. There certainly is some evidence that after a certain amount of time post-vaccination, the risk, again, to high-risk people who are vaccinated might go up a little bit if they do happen to get a breakthrough infection. And this is actually not that surprising because we already know that people who are above the age of 65 need to have a higher dose of the flu vaccine, for example. Their immune systems just don't respond as well to vaccines. So I think boosters are a fine recommendation. I don't think we're going to be needing them every 6 months for sure. And I think that people should really take this information to heart. They should understand that what Dr. Jide said was absolutely correct. The vast majority of patients in his hospital with COVID are unvaccinated people. They're not people who didn't get a booster. They're people who haven't had a single shot. And that's what we really need to be reiterating to people. Boosters are fine, but what is more important is vaccination altogether.
Yeah.
And I just want to just emphasize that vaccination. We are still dealing with, too large a proportion of the country who are still unvaccinated. And we've already talked about the way variants emerge. All we're doing is creating breeding grounds for new variants by not getting our vaccination uptake up. And with regards to boosters, I can tell you that what we're focusing on in our hospital is we're focusing on the immunocompromised for boosters. We're focusing on patients who have a solid tumor or a hematological malignancy, solid organ transplant patients, those who are taking immunosuppressive treatments like high dose chronic steroids, those with advanced HIV infection, for example. So we're focusing our booster program now on that group, that super high risk group. I think everybody else needs to calm down a little bit, and let's continue to push for those vaccination, the initial vaccination, those first 2 doses or those first doses, and focus our energy on that. But in
now,
the meantime,
it's my turn to jump in and emphasize that point. That is the exception for boosters, and there's a lot of data to support that people who are immunosuppressed really do need a third shot. It's not even really a booster. They just need a different vaccine regimen. And I think that's really important to emphasize. But for the general public, again, boosters are going to be available. I think they're fine. I don't think they hurt. There's also a lot of data that does show that it's fine, to get extra shots and to actually even mix and match vaccines. That's what's being done here in Canada. But I think, we need to focus right now on making sure that people are all equally protected, including those very vulnerable people. And right now, I think those are the only people who need to worry about getting a third shot.
Yeah. So I want to jump in really quick. We're getting, and I hope I'm going to influence what you're going to say, hopefully, Dr. Williams. We're getting some questions from the chat space talking about, okay, how do you bring people who are not ready or hesitant to get the vaccine? How do we bring them on board with this conversation?
I think it's really challenging. The issue of the unvaccinated is really, there's a lot of fear. So I kind of see in my experience, it falls into 2 groups. One is folks who are really scared. They have this paralyzing fear about being that one person who gets that 1 in a million side effect, and they just can't get over that. And so I think we need a strategy for those individuals. But there are another group of individuals who are really ideological, philosophical, and much more rigid. And I think we need a strategy for those individuals too. One thing I can say is that I can speak from where I am sitting in our healthcare institution. I'm with Columbia University, as you mentioned, a professor. We're the largest employer in New York City, and New York Presbyterian, one of the largest. And at our hospital, we've over the last year, since the vaccines came out, we've been working really hard to really encourage people, one-on-one conversations, getting peer leaders, getting community health workers on one-on-one, going into the community, fighting fear with facts. We've been doing a lot of grassroots groundwork addressing the issue of hesitancy. We've created pop-up vaccination sites. We've made it really easy for people to get vaccinated. Here in New York City, there are even incentives to get vaccinated, multiple incentives. So we've gone so above and beyond when it comes to those carrots to get people vaccinated. Now we're adding sticks into the mix. We now have a mandate for all healthcare workers at this institution to be vaccinated by a certain date, and all members of the university also are mandated to get vaccinated by a certain date. So we have both the stick and the carrots. And I think that you need a mixture of both of those things to continue to drive up vaccination rates. I just want to say one last thing, because, I just want to speak as a physician just for a minute. I had one of the greatest fears and greatest challenges about treating this disease is when I have to deal with whole families getting infected, entire family getting infected. There is nothing more tragic than I had a husband and a wife who the wife was very sick and she was in a floor below my unit, and the husband was my patient, and the husband asked to have his wife moved into his room on my floor of the hospital. We usually isolate patients, but they're both infected, they're family members, so we brought them together. The husband successfully made it out of the hospital, but he watched his wife die in the bed right next to him. It was the most traumatic, tragic, and this is what we deal with as physicians in the hospital. And this is what does not need to happen if people get vaccinated, because the effectiveness against hospitalization and death is almost miraculous. I mean, if you look across scientific data, the effectiveness that we see is unparalleled compared to other vaccine effectiveness that we've seen. And so when I share this story, it's only to say that tragically, that didn't need to happen. And both of these individuals were under 65 years old.
Well, thank you for sharing that story, Dr. Williams. And it's one of the reasons why we at Hip Hop Public Health, as you know, feel like we have our finger on the pulse, because we get to hear from you about what you're seeing. We've created a resource. You talked about getting the vaccine, and we talked about a question about having confidence in the vaccine. We have added another musical resource about community immunity and the importance of us coming together to not just take care of ourselves, which means getting your vaccine, wearing your mask, social distancing, and washing your hands, but also each other. With that, Lori, can you please roll the new video, Community Immunity?
Got the vaccine, we got the vaccine. We can get back to normal, let me inform you. Let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. Yeah. If Doc says it's good, trust me, it's good. Now let's all get the vaccine.
Dr. Moflo,
It's the hip hop doc. A.
we gotta make this pandemic stop.
We on the clock, folks are not trying to get the shot. While we wary of these barriers, cause there's already a lot.
Alpha, beta, gamma, tricky variants like Delta. Others trying to break down our
They
barriers.
spread to different areas across all nations. We'll never see the end if we keep on waiting.
Let's get it straight. If people don't vaccinate, we know that COVID will continue to spread and mutate.
There's no debate when we gotta keep our loved ones safe.
From the school to the workplace, stay on the
And
case.
get the facts, ain't no time to relax, and that's fact. Help the body attack so our lives can bounce back.
To be free to move and do the things we do.
We gon' do what we gotta do to get through.
I don't know if anybody else was kind of, can't really help it because the beat is fresh. Anyway, so I think that we've hit a nerve. I think it's worth continuing to talk about those who have vaccine hesitancy, because I think it's all, it's that repeat. We have to keep saying it and say in whatever way we can to help people get over whatever that potential fear might be. So I kind of want to go back to social, because I, like many of us, can look through social and see different postings. And some have gone as far as actually utilizing the emblems of bona fide organizations on misinformation images. And I think it starts to get really confusing. I don't want to call it out specifically because I don't want to get people to go Google or look up these things. But I would love to invite you all to talk about the difficulty when that happens, the intentional misinformation of bona fide organizations, science-based or civil rights-based, and then you're adding on a fake statement. And today's need to be clear about COVID, about the variants, about vaccines. I'm going to start with Angela, I guess if you want to, Dr. Angela, start there, and then we'll go to Chuck and back to Dr. Williams.
Yeah, well, this has been a real problem. And I should add, this is not a new problem. The anti-vaccine movement has been going strong for a very long time, and they're really, really effective at distributing their propaganda and targeting specific groups. And what I think is really the most abhorrent is they are very good at targeting groups who are very vulnerable and are particularly vulnerable to COVID. For example, and Chuck brought this up, they consistently target the Black community by bringing up the very painful history of medical violence that has been done against Black people as part of these vaccines. And there's simply no relationship to the two things. These vaccines, the Moderna vaccine, for example, was developed by one of my colleagues who's a Black woman, Dr. Kismakaya Corbett, who is starting her own lab at Harvard. She's truly an inspiration, and she's done a lot of work targeting this specific type of misinformation. There's misinformation directed at women, misinformation saying that the vaccines will affect your fertility, for example. These anti-vaccine groups are very, very effective at this. And one thing I'd encourage people to pay attention to is what they're offering instead of vaccines, because most of the time they're actually selling something. They might not be selling something directly, but they want you to always go to their movie. They want you to buy their book. They want you to go to their website. They want you to take ivermectin, which, by the way, is better known as HeartGard, and that's a deworming medication that we give our pets. It doesn't work against COVID. There's data showing all of this stuff, but usually they're trying to basically sell you something, and it's an elaborate con, which, really the price that you pay for it is not just your money or your time, it's also your health. And I think that's what's really so offensive about it to me. But it is out there, and it's very sophisticated. And so people really do need to follow Chuck's advice and not believe the hype. They need to really pay attention, because this misinformation literally kills people.
Mm. Yes.
Yeah, it's been the growing disease that's already taken place in these markets that people want to get their leg up into, I guess, whatever commerce would put them on top of whatever business heap that they're talking about, that it goes in line with this increased disease of emancipation and anti-intellectualism. And when you continue to try to raise up something that does not go through the discourse of going through the pain of learning and trying to figure out the actual fact of the matter, and you continuously go out there to disrespect that tenure or slap the face of scholarship like it don't mean nothing in lieu of entertainment. I'm in the entertainment business. The entertainment job is to entertain, boom, make it happen and get out. But when it comes down to real things and real life and real people moving and shaking, you got to do real things, man. You got to talk real stuff, real ish, as they say. And there's a lot of murk that wants to get in that water and make it a swamp. Right now in Haiti, they have a serious situation right now. This is not about playing games. Then you have an earthquake, thousands of people have died. They're in a political situation which makes the casual person not even want to be able to go there. So, that's real life. So when you see that in lieu of some business proposal or somebody trying to come up saying that they're, looking out on the behalf of people to watch out, like you said, Dr. Rasmussen, you got to look at that side eye. Like, okay, what's in it for everybody that you talking about? Because you're talking about what's in it for them based on this, but what do you got to do with it? What's good that's going to come out of you that we're going to come and say, yeah, thank you. So this is real. This is very serious. Like I said, I'm in the entertainment business. It's about the interpreters, the middle people, the middle situation that has grown expeditiously between the actual people that do and the actual public that's out there. We can't distort the truth for the sake of entertainment or entertaining people or making the truth even more digestible. The truth is the truth no matter what. It's like rain. It's going to fall on everybody. So you need to say, listen, and I like to say it would be great if somebody like a Rihanna or Kanye West says, yo, hold it. This is what y'all need to pay attention to. This is very important. Don't listen to me. I ain't no damn doctor. Listen to them. You got the unknown coming up, and the doctors are saying it's unknown. So for sure, and I'm gonna put this in regular people speak, for sure your dumb ass is gonna be unknown. So trust us on this. And I'm saying that if you don't want to think for yourself, you got to be able to think on behalf of your elders and your kids.
Yeah.
That's what it's about. It's your elders and your kids. And your elders are thrust in a situation where their age might make them compromise and their immunity situations lowered. In fact, young people are coming into this not knowing for what. You know, we lost a guy, a good brother, last week, who, you know, our business has been compromised. So obviously, he felt that he's got to do, you know, he's going to go out there and make a living because the signs seem like it's clear, but he was unvaxxed. Goes to this hot box situation, tons of people in the crowd got COVID. He catches COVID. He had a situation where he had an asthmatic background. He realized halfway in that he made a mistake by not getting the vax. But by that time, it was too late, and he had contracted, been battling for 10 days at 49 years old. Had an attack, couple of things, took him down, he's out. This information needs to go out there and be able to be co-signed as somebody saying, this is what happened.
Yeah.
This is not something that we're not trying to make you feel good about anything here. This is real. This is, if anybody was talking about World War III, this is World War III.
Yeah.
Because there's no end game right now. There's things that we could probably figure out on how we could get the head over water, which, and doctors have been saying, and I don't mean governments, I mean doctors have been saying all along, there's no end game in this, but you should do the best you can to protect yourself, build your immune system as much as possible. Yes, and everything, but also get some help, which is this vaccine.
Yes. So I want to go to you, Dr. Williams, and I want to also ask you this. Based on what Chuck D just dropped and what Dr. Angela was saying, why do we come up with resources like the video Community Immunity, where we're placing music next to the lyrics that are based on science? Why do we at Hip Hop Public Health come up with that formula?
Well, we Hip Hop Public Health is in the messaging science business, and we truly believe in the power of music, not only as a powerful motivator of new behavior and information, but it also has the ability to make things digestible. It has the ability to make things sticky. It has the ability to connect emotionally. And we can use credible messengers to tell a credible message through hip hop, you know, and also, you know, the demographic that we are targeting are the highest, most vulnerable group in America when it comes to the COVID. I mean, those are communities of color, and we know that hip hop was really born in the Bronx by people of color, by African Americans. And it's their culture, it's who they are, and it connects with them. And so we like to leverage whatever connects with people the most, and use it as an educational tool. You know, we have Chuck in the room, so I don't need to say anything more about hip hop, because we know through Chuck's music just how much we've learned from the work that Chuck has done through song. And so we've taken that concept and we're applying it to health education, to health literacy, and to just information that can save your life. And I can tell you this, Patrice, is that we've created resources that have literally saved people's lives. Within the stroke world, we have actually published data on how Hip Hop Public Health resources actually saves lives. So this is an evidence-driven approach. and we are going to continue to use it and leverage it as much as possible. And we do other things too. We do these town halls. I was out on the street a couple of months ago, going from project to project, speaking to people, because we had set up a vaccine clinic in West Harlem. And so we were going from project to project, speaking one-on-one to people on the street and in the projects to try to get people to come over to our vaccine clinic, which we set up on 125th Street and Broadway. When I went into one of these projects, I was approached by a young man who heard me talking about the vaccine, and he basically told me to stop and leave. And he warned me that if I hung around, that it might not end well for me. And so I left that project. But can you see how deep that is? Can you see how brainwashed that is? Because this could be the same person who will end up in my emergency room, sick with COVID, telling me to please save him. Please save him. And this is the cognitive dissonance that's going on right now. And it's a tragedy, because there's so many people that I have seen who end up with serious disease who have refused to be vaccinated. And yet when they're in the hospital, they're asking for all kinds of medication that I don't even know what's in them. I just know that this is what's approved for this condition. But we know so much about this vaccine. We know more about this vaccine than we know about half the medicines that you're taking.
That's the point, Doc. And, I understand the fear factor. Trust me, I was scared as hell to never touch cocaine, Hennessy, vodka, scared the hell out. So I had a fear factor too. I'm like, I'm not going near that. So when cats come with that fear factor of what they're afraid of, but yet and still, they ain't afraid of everything. So I understand the fear factor. But I'm saying, if you scared, be scared of a lot of things out there. And a doctor for hell ain't gonna be able to tell you that he prescribed Hennessy to you every day. So that's one thing that ain't gonna happen. So it's a job, once again, of the artist or the poet or the newscaster or the blog owner to be able to, that's the thing that's the ones that have to make it digestible. The middle people that have to take the know-how, the years, the tenure, and the concern and care of doctors and practitioners. People are there, like the nurses that they're on the battle lines, putting their lives on the line, trying to save your ass.
And you know what, Chuck? You know what we see when we have. I started earlier by saying that of the 180 patients we have in the building behind me, 99% of those COVID cases are unvaccinated.
Right.
This tells you one thing loud and clear, that vaccines work. The only way for us to climb out of this darkness, out of this pandemic, is to vaccinate our way out of this pandemic. The best way to save Black lives right now, people talking about Black Lives Matter, the best way to save Black lives now is to vaccinate Black lives. And there's nothing else. There's nothing else that's on the horizon that can get us through this darkness into the light. And so we need to really talk to all our loved ones. If you've been vaccinated and you're listening to me or listening to one of us right now, and you've been vaccinated, find 10 people who have not been vaccinated and sit down and have that conversation with them about getting vaccinated. Tell them that not only do they need to get vaccinated, but tell them that they should wear their mask more responsibly. A lot of us who've got vaccinated, we've dropped our guard and we don't think we need to wear a mask anymore, but we do still need to wear a mask. Some of my colleagues who are vaccinated have developed breakthrough infections. They're not sick and they're not in the hospital, but they have mild symptoms and they can spread it. And so it's important for us to wear our mask and promote vaccination within our entire networks.
I couldn't agree with that more. And, Chuck said earlier that we need to be getting this message out that there's no end game, but there actually is an end game. The end game is to do exactly what you just said, Dr. Williams, to get as many people vaccinated as possible and continue taking precautions in the meantime, because that's how we're going to be able to lift those precautions. And as long as we're talking about the lives of people of color, we also need to think about outside the United States. Right now, there are countries that have had no doses of vaccines administered to healthcare workers or anybody else. One of the reasons for that is that the supply of vaccines that could be going to those countries is going to Americans because we still have tons and tons of community transmission. I think one thing that doesn't get focused on enough is the fact that we are a global community, and the vaccines don't just protect the individual getting them. I love how Hip Hop Public Health emphasizes community immunity, because in my view, that is the true power of vaccines, the true transformative power. Vaccines basically removed the scourges of polio, of smallpox, of these viruses that people lived in terror of, that terrorized the entire world, essentially. And with vaccines, they were gone, essentially, from people having to think about them in their daily lives. We take it for granted that we don't know people our age who have polio. And I think that we really do need to talk more about the power of a community being vaccinated, because that is how we're going to, we may never get rid of COVID. As a virologist, my opinion is that it probably will become endemic. There will always be COVID circulating, but we don't have to think about it every day. And the way that we get there is by empowering the public with information, by getting people, by winning hearts and minds, having those individual conversations. And really, you can't have public health without the public. So, keep at it and keep encouraging people to get vaccinated, because that really is the end game.
Yeah. Thank you. Thank you. Thank you. We could keep talking about this at least for another hour or so. And while we can't do that tonight, hopefully we'll get this group back together again to talk more about what's happening around COVID-19 and the variants and the vaccine. And hopefully our numbers will be much higher in terms of those who've been vaccinated. So we're going to wrap it up. And I do want to have a little bit of good news. Today in the Bloomberg news, the following was noted in an article. The number of people getting a first dose of COVID-19 vaccine has risen to almost 500,000 a day, a level last seen at the end of May when the U.S. vaccination campaign was still in full swing in much of the country. So maybe this stick is starting to work, Dr. Williams. Maybe people are starting to jump over that fear and just do it. I do want to wrap up, again, like I said, quickly, and just thank you all. Thank you, Munson, at Rolling Out. Thank you to all of our viewers who've watched. And if you forward this, which I hope everybody will, forward this to somebody you love or somebody you just like a little bit, and see if they'll watch it, and then have a conversation. To Dr. Williams's invitation, talk to 10 people and talk to them about what do they need to be able to have more confidence in getting the vaccine. We are Hip Hop Public Health. What we do is take science and play it to music and make up some nice dance moves. Everything that we have is free. It's on our website at hiphoppublichealth.org. And who would we be if we didn't leave you with a mashup to remind you to wash your hands, everybody, and everybody wash your hands, to wear your mask and socially distance. Thank you so much, Dr. Angela, Dr. Williams, Chuck D. Thank you for your time. And to those watching, Lori, roll the final video, please.
My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands. That's right.
First and foremost, please listen close. Take your time, wash. Use a lot of soap from the front to the back, back to the front. Sing the hook where you at. That's exactly what we want. If you decide to leave, please take heed. Talk a social distance, at least 6 feet. On a bus or the train, riding in your car. The further you're away, then the better off you are. 20 seconds or more. You gotta be able to wash your hands like you never ever washed them before. 20 seconds or more. Try to wait, you'll make the greatest mistake. You need to wash them when you enter the door. 20 seconds or more. Take your time, sing a song, spit a rhyme. When you finish, you can put on some gloves. 20 seconds or more. It's very important to wash your hands. You're protecting everybody you love.
Yo, What's up, y'all? This is Doug E. Fresh, and I'm back again with Ted Smooth and a lot of my friends. Come on.
Si te deja de cuidar. Epidemia, pandemia, distancia social, sin manosear.
Uno, dos, tres.
Lávense la mano todo el mundo y que todo el mundo lave las manos. Lávense la mano todo el mundo y que todo el mundo lave las manos. Latino, lávense la mano. Pa' 20 segundos, lávense la mano. Con mucho jabón, lávense la mano. Cuídense mucho y lávense la mano. Primeramente, escucha atentamente. Con mucho jabón, lávate suavemente. Con la izquierda, derecha, derecha a la izquierda. Ven, dame coro, canta letra por letra. Quédate en tu casa, tranquilo y quieto. Pero si vas a salir, quédate 2 metros. Aparte de la gente, la guagua y el tren. Con máscara pa' tapar la nariz, ven, ven. Lávense la mano todo el mundo y que todo el mundo lave las manos. Lávense la mano todo el mundo y que todo el mundo lave las manos. Lávense la mano.
United, the Love Life way. Together.
It's a symbol of love, a symbol of trust between us. I wear it for you, you wear it for me. I promise. I put on a mask out of respect for the masses and all those left behind. To salute and honor all the first responders battling on the front line.
All the goodwill people.
If you got my back got your back. Behind the back. I believe I was to ask. So let's say the word. Behind the back. What time that you feel alone? Just know you're not invisible. 'Cause I still see you behind the mask.
I see you, I feel you.
Now we can't pretend the state that we're in not dangerous. 1 minute we're close, then 6 feet away like strangers. There's a virus outside threatening all our lives, and we can't let it in. Not just for you, but for all. To prevent a loss, we put on the mask for them.
Come on, y'all.
If you got my back,
I got yours.
got your back.
You got mine.
Behind the back, I got your back. Was to save the world.
That's right.
Behind the back, and if you feel alone,
Come on.
just know you're not invisible.
We in this together, y'all.
Still see
I see you.
behind the mask.
I feel you.
I see you. I see you. Still see you.
That's
See
right.
you behind the mask.
And I feel you.
Here we go.
DMC.
Here's a little story about this year. Who would have thought we would end up here? New decade, we was barely in it. New year came with a world pandemic. It will get better. The storm will weather. Heads held high as we stand together. Gotta do our part to stop the spread. Gotta pull together, don't be misled. Wash your hands, make sure they're clean. 20 seconds or more if you know what I mean. Put a mask on, it don't matter what kind. The cloth, surgical, or the N95. Before you take your mask off, go wash your hands off. Fold it outside so you can keep the germs off. Store the mask in a paper bag. Then one last time, go and wash your hands.
That's right. We in this together, y'all. I see you, and I feel you, and I'm with you all the way.
Yeah, I still see you behind a man.
Ladies and gentlemen, this is real right now. Raheem Devon, DMC. My name is Doug E. Fresh. Please wear those masks. Is that a lot to ask?